Mambo kwa sawa?
Thank you very much. I wish to take this opportunity to appreciate you for joining me on this tour of the Jomo Kenyatta International Airport, where we have come to confirm our preparedness as a country in terms of Ebola prevention and response measures that we have taken as a country. I start by confirming that the attention of the Ministry of Health had earlier been drawn to a confirmed Ebola virus disease outbreak in Kasese district, Western Uganda, and we issued a press release on the 12th of June this year on the same, following the appeal to the public to remain vigilant and to report any suspected cases. A 36-year-old lady who had traveled from Malaba town on the Kenya-Uganda border presented herself on the 16th June 2019 to a health facility in Kericho after experiencing symptoms of headache, a fever, and vomiting. The Rapid Surveillance and Response Team, which has been set up to respond, has examined the patient, who is in stable condition, and has confirmed that she does not meet the case definition of Ebola. Allow me to confirm to Kenyans that the patient does not meet the case definition of Ebola. Precautionary measures, however, have been put in place, including isolation of the patient and submission of blood samples to KEMRI for testing. The results of the same are expected by 4 o'clock this evening. I wish to reassure all Kenyans and our visitors that we do not have any cases of Ebola. And indeed, the ministry has undertaken and continues to implement the preparedness measures, which include the following. 1, an alert to all health workers and the general public has been given to enhance surveillance measures. 2, National Ebola Preparedness and Response Contingency Plan has been developed, which is guiding the implementation of Ebola prevention and response activities in the event of an outbreak. 3, coordination of preparedness and response interventions through a multi-agency Ebola Preparedness and Response Committee, coordinated and chaired by the Director General of Health, Dr. Masasabi, who is with me here today. The Ministry of Health, number 4, has also established a rapid response team in headquarters and teams in the counties comprising of medical specialists in disease control and laboratory scientists who are trained in investigation and testing of Ebola virus disease. Number 5, screening of incoming passengers and travelers. This is being done using thermal scanners, which are automated, as well as the handheld thermal guns at the major airports and other ports of entry, including Wilson Airport, even though that is mainly handling domestic traffic. Finally, facilities for isolation of any suspected cases, case management and infection prevention and control exists in our major facilities, including Kenyatta National Hospital, here at the Jomo Kenyatta International Airport, and you have just witnessed that, among others, for isolation and management of any suspected cases. The ministry has also prepositioned personal protective equipment and other supplies, including pharmaceuticals, non-pharmaceuticals, hand hygiene supplies, and examination equipment in all our points of entry. I wish to further confirm that the ministry has a total of 259 staff deployed at the various ports of entry, and in addition, we have in the last 1 week deployed 21 Ebola champions who have been brought in to support the national team. It will be remembered that Kenya contributed to fighting Ebola in Liberia some years back by getting some of our HR attached in Liberia They have since come back and they have joined my team in the ministry, and we have therefore redeployed them to the ports of entry to support the local team. As a ministry, we remain committed to ensuring that relevant surveillance measures are in place to safeguard the health of all Kenyans and our visitors. I wish to remind members of the public to remain vigilant. Those with any cases that range from fevers, chills, headaches, and especially history of recent travel to affected countries should present themselves to the nearest health facility or contact the Ministry of Health Emergency Operations Center through the following hotlines: 0732 35 35 35 or 0729 47 1414. I call upon my colleagues in the sector to also be careful with the information and how we position to the public. I also invite you, the members of the press, to also be vigilant and be your brother's keeper. In DRC today, we have 1,300 people who have already died out of Ebola. It means, therefore, if we use the word Ebola and it's likely being around, it's going to cause untold panic for no good reason. So let's confirm every story before we air it. Let's be careful how we package the information that gets out. We owe this country and the public that much duty of care in terms of what we communicate. I thank you.
Probably when we look at, my name is Enoch Sikode from Citizen TV. When we look at the events of today, it just confirms about the scale of Ebola. And given that last year we were talking about DRC Congo, today we are talking about Uganda. And that is why probably there is that scare that it's any time, if we're not careful, it can cross into Kenya. So probably the basic question will be, are we prepared as a country fully, with certainty that we can tackle Ebola in case, God forbid, it crosses into our territory?
Thank you, Enoch. Let me change the conversation a little bit. Let me request Kenyans not to panic. Let me confirm that we shouldn't be scared. And the reason we are here with yourselves is so that you can actually live the experience of our level of preparedness. We are prepared, and this is a message I want us to take out to Kenyans. We are completely prepared, with both availing the commodities that are required, with availing the expertise that is required, and in fact the best expertise that one would ever think of, including the Ebola champions I've talked about, but also working together with colleagues from the other arms of government, the Ministry of Defense, the Ministry of Interior, to make sure that our surveillance and response at all the border posts is better than anyone that you get in a situation like this. So we are prepared. But we keep praying and hoping our intensified screening would then help us detect anybody at the border post and before they come in. So Kenyans, no scare.
Thank you so much, sis. My name is Seth Onali of MTV. And in terms of public sensitization, in terms of the probable symptoms and how to go about it, can the government do enough in terms of, because there's a lot of panic and even anxiety in terms of the events of Sunday evening up to now. So in terms of public education, in terms of how Kenyans should treat this particular issue, that is one. Number two, yes, we're here at the JKIA, but what about the borders that involves the land, especially exchange, and we know that there has been incidences of civilians crossing borders, not necessarily at the authorized border entry points or exit points. What happens to that particular situation?
Thank you very much. Two responses. The first one is intensifying our sensitization and public communication. And I take it that, again, as I appreciate you, you are here so that you help us in dealing with this. There isn't enough sensitization. If we can speak about Ebola in terms of our preparedness, in terms of what to look out for, the better for all of us. So I am urging you, members of the Fourth Estate as well, to be partners with us so that we can be able to get the right information to the public. not just about Ebola, but about matters health. On to the second issue, my colleague responsible for immigration has actually just got caught up. He was supposed